Hello?
Yes, madam.
Okay. Now I'll just go ahead with the presentation.
Okay, okay. Yeah, please.
Wait, I have to open up the PowerPoint. Let me do that. What is this document recovery thing? Because I shut it down, huh?
Yes, that's why
But,
is that.
yeah, but how do I get the whole screen again?
Yeah, you go to the slideshow.
Sorry?
Go to the slideshow mode. You can just
But I'm not able to get that image,
no.
slideshow
On the
image.
top, there is a slideshow is there, no? Next, no. Right,
After 2, 3, 4. Yeah.
right, right
To
to
the
the
right.
To the right.
somewhere, no.
Yes. Okay, fine.
Okay,
Got it.
from the beginning.
Okay, but let me get it's not coming as a slideshow, no?
No, you have to click on that from beginning.
Click on the slide, is it?
No,
No,
from
no. Slideshow. Then you go. Then after you can from the beginning. No,
To
no.
the
Here,
left side, ma'am.
To
Left side below slideshow.
left side.
Left side. Yeah.
From beginning. Okay.
Ah.
I'm so sorry. I'm so tech
No problem.
disadvantaged.
Yes,
That
yes.
is, anyway, welcome to everybody who's here, and thank you very much for putting up with all my difficulties with technology. But I'd like you to appreciate the fact that at 73 years old, I've learned all this in the past 1 to 2 years only. And I hope that gives me the justification have to have troubled all of you so much. Anyway, I'm really glad you are here. Now, in today's world, it is very important for us to be grateful for the fact that all of us are able to attend such a session. We are able to meet together across Zoom. So we have to thank God for keeping us safe. We also need to pray to God to help those who are in pain and give strength to those who have suffered loss. Because so many people we know have suffered loss. And as a doctor, no matter what talk I give or in whatever subject I speak on, I cannot emphasize the fact that in spite of vaccination, in spite of the fact that things are looking a little better now than before, every one of us has to follow the safety norms of double masking, regular washing of hands, social distancing, and staying home unless it is absolutely mandatory for us to go out. So, with that introduction, we'll get into the main subject of the talk today. Ergonomics is a very fashionable term which is used actually in design, in the medical arena, in workplaces, when it comes to health, human employees. There are so many areas where we use the word ergonomics. Now, what is this ergonomics? It is the effect of health and safety in a working environment on the productivity of a person. So, unless the person who's doing the work is comfortable in his movement, in his standing, in his sitting, he will not be able to execute the task effectively. And if he doesn't execute the task effectively, he is not going to be productive. So, the science which deals with the relationship between man and his work environment is what is called as ergonomics. It is actually a scientific study of human work. So the best position for a person to stand while working in a foundry is different from the best position a person should stand when they are working in a cotton mill or a textile mill, or when they are doing prolonged sewing like they do in these tailoring outfits. So you have to design the job to fit the worker or force the worker to fit the job. So what we try to do is we design the work environment in such a way that it adapts to the worker. Now, we are all, each of us is of different body types. So one solution is not going to work for everybody. But there is an average solution which works for the average person, average height, average weight, average build, and for the way that job has to be done. How the hand has to be moved, how the leg has to be moved, how they have to stand, how many hours they have to put into it. So all of this combination of weighing all these factors is what is called as ergonomics. So the essence is, what we are trying to find out is your posture hurting you? So let us look at various things that we do every single day, which could be hurting our posture. So a practical approach to ergonomics is to match the person, the equipment, the work process, and the work environment. So enough light also actually constitutes part of ergonomics. It's not just the position and posture. So if you have a poorly designed workstation and you have poor working practices, you get what are called as musculoskeletal disorders, which is a common complication today from many offices. And now when we are working from home, we are not having a clear office space. And so we are not having a clear office table or office chair or whatever. And so we are sitting in odd postures and odd positions and actually worsening the ergonomics of the situation. We are what is called as poor ergonomics is what we are employing. Now, for instance, when we are texting, now we'll go one by one. The common thing that all of us have is a phone, and we are constantly texting. So it is called the text hunch. So what happens when you lean downwards and look downwards, you get a hunch like this. When you do that for a long time, you will get a neck pain, a shoulder pain, an upper back pain, mid back pain, and even your breathing can become uncomfortable. The right way to do it is lift the phone up, hold it up in your hand, and do the texting. But I don't think any of us do this. Most of us are in this position only when we are doing the texting. Now, this is also called the eye hunch. When you do this hunch, when you give a 60-degree tilt to your head, what you're doing is you're putting 27 kg of weight into your spine. And that can be very difficult over the long term. It's a burden on the spine. So you need to have your neck straight like this, and then you're not putting any weight on the spine. So if you are half inclined 30 degrees, you're putting 18 kg of weight down your spine. If you're 60 degrees tilt, it's like putting 27 kg down your spine. But when you have your neck straight, when you do something, it is zero weight upon the spine. Now, when you're sitting in a chair and doing it, again, you can do this hunch, the text hunch. So what you need to do is prop up the phone or prop up the tablet a little bit, and so that your spine is straight. So you can do various corrections like this. When you're standing, you make a stand straight and lift it up. When you're sitting, you have to slightly lean backwards, move a little forwards so that you can elevate the thing on a cushion or a pillow. When it's a laptop, again you can hunch over it. So instead of that, what you need to do is sit straight in the chair and have the laptop at the comfortable height. We are going to address what is the correct posture for the laptop. Then we have this sitting on the sofa. Now, most of us who are working from home are sitting on the sofa and using the laptop for our work. So people adopt all kinds of peculiar postures. Now, this is a very common posture which youngsters adopt. Some people lie down and then half sit up, do some work, then lie down again, half sit up, do. So this is very, very traumatic to the upper neck and upper back. So ideally, if you want to overcome the laptop slump, the best way is to sit on the floor like this, have your back support, and keep the laptop in your lap and use it. You can also sit like this, you're fairly comfortable. You can put a cushion here at the back, or some people are very comfortable lying on their stomach. Many people read in this position. You lie down on your abdomen and prop up a book and read. So you can find that if you put a little cushion under your tummy, this may be a comfortable posture in which you'll be able to work fairly comfortably, keeping the spine straight. The rule here is the spine has to remain straight in whatever position you take. Now, somebody had raised a question on what are the ideal postures for sitting on the ground. Now, if you look at traditional societies, you will see what are the ideal postures for sitting on the floor. Because all these traditional societies are used to sitting on the ground, doing all the work sitting on the ground, and sitting for long periods of time on the ground. So, you've got this posture where you've got one leg folded underneath and one leg flexed and supporting the body. Now, people are able to sit for very long periods of time in this posture. The typical chaplangol of that we all sit, or the cross leg position, the ordinary cross leg, not the yoga padmasan where you lift the foot and put it on top, is a very comfortable position. Another place where we can learn what are natural, comfortable positions, especially for sitting on the floor, are when we look at children. See, this child is actually naturally adopting this posture, which this person is sitting in. You look, there's a similarity, only thing it's on the other side. So we need to understand that if we watch children and watch traditional societies, we know which are the best postures for sitting on the ground. Now, if you are very fairly agile, you can sit like this, just a squat as it were. And many of in our villages, you'll find many people sit like this and do a lot of work. They wash dishes, they wash clothes, they cut coconuts, they do anything. Then this side saddle as it were, where you have your two knees bent and the legs are like this. Many women sit like this. And they find it very, very comfortable to sit like this. Vajrasan is used a lot, both here Modi is doing it, is used a lot both in Japan and in many cultures. And in India, you have to be fairly fit and capable of doing Vajrasan. Not everybody can do Vajrasan. So that is also a very comfortable position because your spine is straight. Now these cross-legged squatting, kneeling positions, etc., they stretch our hips, they stretch our legs, they stretch the pelvis and the spine, and they keep the spine straight, and they help to promote natural flexibility and movement. So most of us nowadays are sitting in a chair. So should we start sitting on the floor? You'll find that now more and more people are finding it more comfortable to sit on the floor, like I showed you, leaning on the sofa and using the laptop, because that seems to be our natural way of sitting. And we were, when evolutionarily, initially we never had chairs. Maybe we would sit on a rock, but beyond that, we would not sit on a rock for a long time. We would sit on the ground only. Now, more and more of us doctors are advising people that sitting on the floor is good. Also, the yoga therapists tell us that sitting on the floor, you're also grounding yourself. See, when they do a grounding meditation, they ask you to keep your feet flat on the floor. So you're also grounding yourself when you're sitting on the ground. And it also supposed to improve the strength and flexibility and avoid lower back pain. So what is the best way to sit, especially on the ground? A comfortable sitting position will vary from person to person. But what is most important is whether you're sitting on the ground or sitting on the chair, keep changing your position. Because sitting in one single position becomes a strain for the lower back muscles. So you can sit cross-legged, you can sit leaning on the wall with your legs stretched out, you can sit in what is called as the 90-90 position, you can sit like this on the side where you're leaning on your hand. You keep changing your position. And the basic mantra is listen to your body. It will tell you what it needs. Next, we got this again in the tablet tilt, we are slouching. Now, children are using the tablet a lot nowadays. So we need to teach them what are the good positions. So this is a good position. Lying down and looking at the tablet is a good position for the spine. Again, sitting straight, with or without support, and keeping the tablet erect in front of you is a good thing. And here again, we already said the text hunch is avoided by lifting the tablet in your hand. You can sit in a chair and see a tablet. You can keep it on a cushion and see a tablet. You can prop it on a stand. You can tilt it a little bit on a table. So there are many good ways of having a good posture while you're looking at either a phone or a tablet. Another place where we have bad posture is in the treadmill. Many of us think holding like this, leaning forward, looking at television in front, is a good way to walk the treadmill. When you're looking at the television in front, you're lifting your head and you're straining your neck. Also, when you lean forward, you're straining this part of your body, this lower part of your body. So the ideal way to walk on a treadmill is to keep your spine and body straight and walk straight, look straight. Then we've got the couch slouch. Again, in the sofa, most of us are adopting crazy positions. Now, this is a strenuous position. It's bending the spine very badly. This, you cannot do this for too long. You can do it for short periods of time. This gentleman, he has fortunately propped his back with a cushion, and so it's not too bad a position to be in. And this, of course, is just a totally complicated, crazy position that he's got with his legs here and elbow here and arm there and everything. Now, ideally, this kind of chair is advocated for many people because it has a neutral spine posture and an alignment. But this is an expensive thing to do. But if we improve our posture in just the common things in which we sit, there are just very easy things to do. But the whole goal is to keep your spine straight right from the neck right to the bottom. Now, what are the common problems that we get due to the posture? I told you they are musculoskeletal disorders. For computer professionals, particularly because of the wrist being not continuously resting like that and working, you get what is known as carpal tunnel syndrome. In carpal tunnel syndrome, there is a nerve which supplies this part of the hand, which is pressed upon, because in the wrist, we have little grooves in the bone in which the nerves and the blood vessels, a lot of nerves and blood vessels come to the hand from the forearm. Now, these go in there and they have to be packed because they've got only a narrow area in which they can go. But if they are just packed helter-skelter, they will be entangled. So there are little grooves in the bone, and over that, into those grooves, these tendons and vessels go, nerves and blood vessels go, and they are protected by a membrane. Now that membrane is necessary to hold all these in a fixed position. So what happens is when you are going on damaging this part of the wrist, you're inflaming that membrane. And when that inflammation happens, it gets swollen and it presses on the nerve, and you get symptoms in this part of the hand where you'll get pain, and you can actually even get muscle wasting in this area if you leave it for long enough. The other area where you get a musculoskeletal disorder very often is in the shoulder. You get what the inflammation of the tendons of the shoulder. It is called rotator cuff problem, because what happens, this position, you are unable to do this movement because you're doing this and sitting, and so you're putting a strain on this, you're hunching your back and you're straining that. The other thing which happens is a low backache. Now, the low backache may be an innocuous, simple muscular low backache. The normal disc, which is a cartilaginous thing which is present between vertebrae, it looks like this. But when it is degenerated, it looks like this. It can get swollen and it can bulge, and when it bulges, it can press upon the nerves. If the bulge is very big, it bulges out of that boundary and is called a herniated disc. In older age, there is degeneration of the disc. Now, why do we need this disc? This disc is like a cushion, which is present between each of the spinal bones, spinal vertebrae. And if the cushioning is not there, when we walk, there will be an impact from every step that we take right up to the head. So this cushioning is very necessary. It's also necessary because to separate out the nerves which are exiting from the spinal cord, which is running inside the vertebra, within the vertebra. So what happens when we actually sit down? the anatomy of sitting, if you look at it, there what we do is there's a natural curve in the neck and in the lumbar region. It's called a cervical lordosis and a lumbar lordosis. When we sit, we flatten the lumbar lordosis. Then the thigh muscles and the hip flexors, they get tighter, and it makes our thigh bone and our leg, upper leg, the thigh portion, it makes it at 90 degrees. And then again at 90 degrees at the knee, it bends again. So this improves the way the spinal load happens to avoid a disc prolapse or a disc degeneration or a disc bulge. So ideally when we sit, this gap is not desirable. Now in my chair in my clinic, there is a gap here. So what I do is I put a small cushion in this place because I cannot change the chair. So I just put a small cushion in that place and sit against the back of the chair. So the correct posture is when the spine is aligned with the lumbar support. So many chairs for computer professionals will have low back support and not have too much upper back support. It's very crucial to have both upper back and lower back support. The other thing is the elbow bend. We have to, if the arm of the chair is a bit too low, you will get this angulation and you don't really get enough support for the whole forearm. The ideal armrest should give you a 90 to 100 degree angle at this place. If the armrest is too high, then again you go like this, you start slouching like this, and then that can give you hunched shoulders and can give you a shoulder pain, upper back pain. When we stand, again, it is ideal to have everything in alignment. But this is how majority of us stand. We hunch our shoulders, we push our tummy forwards, and then we are totally malaligned. So when you do this, the neck muscles get weak, they get tight. You get weakness and tightness of the muscles at the back here, and you get weakness and tightness and flabbiness of the muscles at the abdomen. So erect posture is ideal. But as you grow older, because the spine itself takes a bend, some of this can be avoided if you are accustomed to standing straight throughout your life. So even when you're 70, 80, 90, you'll find that your spine need not flex forward and bunch forward. Also, if you have osteoporosis, the spine will naturally get atrophic, and so it will start hunching forwards. So when the spine is malaligned, the risk of getting a disc is very high. And this disc will subluxate or dislocate out of that. So how we have to stand is, this is how most of us are standing. Otherwise, some of us are standing like this. We may pull our tummy back, but we've got a forward bend and a hunched shoulder. So this is the worst posture, but this is the posture that most of us adopt. Now, let us take a look at what you should do with your computer screen. So you have to view your computer screen with a straight neck. So your screen must be in front of you at a comfortable viewing height. You should not look down on your screen or look up at your screen. Both are difficult. So you need to angle it so that you don't angle it so that you have to twist your neck. Now, some people will put their keyboard and mouse in front of them with the screen to the side. Now, that is not good because your neck will start paining after a while because you're looking at the keyboard like this, and you're looking at the screen like this, and your keyboard and mouse are in front of you like this. So if you have a separate screen or if you're using a laptop, you might even have to elevate it by putting some books or a cardboard box or something so that it comes to your eye level. Because now we are working from home. We are working without ideal work tables. So you may have to make these adaptations. To minimize your eye strain, never sit with your back to a window or facing a window, staring into the light. If you have your back to the window, you will get a lot of light glare on your screen. Ideally, the window should be to the side. But if you are forced to work with a window behind you, put thick curtains or dark curtains. And remember that some of our dining tables have a glass cover. So if you're working at a glass table, cover it to prevent a reflected glare from there. Again, if you have to read any documents, try to keep them in a vertical position to read. Try not to look down like this. If you're looking down like this and doing this, this movement is going to cause a severe neck pain over time. If your laptop is raised, try to have a separate keyboard so that it's not a built-in keyboard, because you cannot go up like that and type. So you make sure the keyboard and mouse with your forearms and your hands have to be, I told you the desirable angle is 90 to 100 degrees at the elbow. And this will leave your hands free to do. Now for the wrist, there are a lot of cushions and pads available. So you can wear a wrist pad to prevent this repetitive injury to the membrane here. So ideal position is this. The shoulders are relaxed. There is back support. There is arm support. The thighs are horizontal. There's a 90-degree here. Feet are flat on the floor. The average height of a table for a computer should be 25 to 30 inches. And the eye should look like this, directly to the top of the computer screen should be the eye level. Then your view will be here. So this is the perfect position. Now let us see somebody who's sitting and doing this. Now she has propped her laptop on top of a cardboard box. She has a separate keyboard and a mouse. And though she's not got upper back support here, this is a work from home adaptation. She is sitting in a chair, which is giving her support right up to here. There is not enough support here, so she has put a cushion there. And her thigh is horizontal, the knee is there, the feet are flat on the floor, and she has some reading material which she has to type from or look from. She has propped that in a stand. Now, many of these stands are easily available and they're not very expensive. And so we can set ourselves up for a proper work from home kind of atmosphere. What happens if you have a poor sitting posture? Now, each of these angles will compress various parts of your body. So there's an angle of compression here onto your abdomen. There is an angle of oscillation here, again, because you're moving your body, upper body forward and backward like this. There's an angle of oscillation here, which can again scrunch your stomach. And there's a stoop angle from your neck and head going forwards. So this causes a lot of pressure on the internal organs here. So it will inhibit the blood flow to the brain, to the heart. It can shift your breathing, your diaphragm function. It will shorten the muscles in the front of the body. It will strain the lower back. It overextends the back muscles. It closes off your throat and windpipe because you're like this. It constricts your voice. It makes you adopt this bending forward posture, which I told you about. It gives pressure on the kidneys, colon, stomach. It can interfere with the flow of cerebrospinal fluid to the brain. It can invite osteoporosis because it's got a very strange posture which the spine can take. And it causes a lot of other kinds of damage on the solar plexus and may even affect your sleep. So it's not something to be taken lightly, and it's very important for us to take trouble to adopt the correct sitting posture, particularly now when we are working from home. Now, these are all the musculoskeletal disorders that can happen. I told you there's something called carpal tunnel syndrome. I explained it to you. There's rotator cuff syndrome, which is at the shoulder level. Then you get in the neck, you get just cervical strain. You can get a sprain, you can get strain, you can get headache. At the shoulder level, you can get rotator cuff strain, and you can also get what is called as biceps tendinitis. The muscle in front here can get tight and inflamed. If the elbow position is not okay, you get tennis elbow, you get overuse, repetitive strain injuries. You can get mid-back pain and postural strain because of your bad posture. Wrist pain, carpal tunnel, there's another de Quervain and Steiner synovitis. Don't worry about the big name. You can also get what is called as trigger finger. One finger will get stuck like this. Then you can get sciatica. You can get knee pain. You can get a herniated disc. You can get low backache. And there are so many musculoskeletal disorders that can happen, all of which are purely due to a defective posture and defective ergonomics. So, what are the do's and don'ts, especially for those now working from home? Don't hunch over your laptop. Don't let your feet dangle. Don't turn your couch into your workstation. Don't skip lunch and make sure you stay hydrated. Many people are working 6 8 hours at a stretch, not drinking water, not having food, and trying to finish a project. Work at an appropriate height. Use an office chair if possible. But if you have a current chair, you can adapt it. That's what I have done. For instance, I have just adapted an ordinary plastic chair, which I'll show you. I've adapted an ordinary plastic chair with cushions. And I'm able to sit for many hours and do my work on that place, do most of my office work. Follow the 20-20-20 rule. I'll tell you what that is. And in work from home, another thing is one day we'll work on the sofa, one day we'll work on the bed, one day we'll go and work on the dining table. So try to fix some part of your home as an office space for to fit you. And make sure that while you are working, in between you get up and walk around a little. Now, to do that walk around thing, there are two things which we can do. One is the 20-20 rule is to relieve eye strain. Every 20 minutes, take a break for 20 seconds, look at an object 20 feet away. This computer vision syndrome is a very, very major stress injury in the workplace. Staring at a computer screen for too long can cause a headache, blurred vision, dry eyes, watery eyes. So it's very easy for you to just follow the 20-20-20 rule. It's so simple, but you just have to be aware of it. And every 20 minutes, your eye goes off the screen. So then what happens is the accommodation sets in. Accommodation is the ability for us to look at a distant object and then adjust to a close by object, and vice versa. Looking at a close by object and then adjusting to. So it exercises the eye muscles and gives it a rest from the continuous looking at the computer screen. And as far as getting up and walking around, I follow the Pomodoro method of time management. Now, the Pomodoro method is very, very simple. Whatever task you have to do, you decide what you have to do for that day. You set a timer for 25 minutes. You work on the task until the timer beeps. Then you get up and take a short break for 5 minutes. I recommend that we get up during that time, walk around for a while. You can have a cup of coffee, you can drink water, you can just stand and look out of the window. You can close your eyes and sit quietly. You can maybe even lie down on your sofa for a few 5 minutes. And after that, come back to work. So if you do this every 20 minutes, every 25 minutes, for 5 minutes, you're taking a break. And after you've done 4 segments, that is 120 minutes, 20 minutes, 20 minutes, you've got 120 minutes when you've done, take an half an hour or 1 hour break. Now, if you look at the way we work from home, roughly we work from 9 to 1 or 10 to 1 in the morning. And the afternoon segment, we roughly work from 2 to 5 or 2 to 6. Few of us work later in the evening because of the international jobs that companies we are working with. And we may work from 2 to 12 or 2 to 2 or like that. Whatever system you are having to do your work in, if you say 10 to 1, every 25 minutes taking a 5-minute break is not a big deal. Anyway, in the office, if you are in the office, about 11:30, you get a coffee break. And at 1 o'clock, you get your lunch break. Then again at 3:34, you get a coffee break. So it is as good as that. And you'll find that you're able to be more productive and you're able to put in really focused work for that 25 minutes that you're working. I follow this. It's called the Pomodoro method. And I follow this in my daily life. And I find it very, very simple to follow and very useful. And it gives me the breaks I need so that I don't get a backache or feel uneasy. Now, I want all of you to be with me. Please open out your videos. I want to see all of you. Yeah, we are just going to do some very simple breathing exercises which children do. Okay. So I want you to breathe in pretending you are smelling a flower, and breathe out as if you are blowing a leaf. So when we smell a flower, what do we do? When we blow a leaf, what do we do? So
You are on mute, ma'am.
yoga is union, as PVS said, and it is mind, body, soul, union of everything. And what we need to understand is, like we have holding your postures. Where does yoga help you? Yoga will help you because we have what are known as asanas, which are just postures in yoga. So what it does is it trains your body to hold certain straight, correct postures and stretches all the muscles. Now you can also do this. These breathing exercises, which I'm telling you, are so simple that they are actually done for children. So you can look at a leaf, you can trace the side of the leaf to breathe in, for instance, and trace the other side of the leaf to breathe out. So inhale, exhale. So you can do this with children, you can do this with yourself, and you can do this in the office. You can do this by visualizing a leaf. You don't actually have to have a leaf in front of you, or you can draw a leaf and do it. Another thing that is done is what is called as the lazy 8 breathing. Here again, you start in the center, go like that, breathe in. Then when you come to this side, you breathe out. Then again, you breathe in and you breathe out. You can do this at your pace. Another method that is used is breathing in for 3 counts in a triangle, holding for 3 counts, and breathing out for 3 counts. So this is something that all of us can do. But now I'm going to teach you a de-stressing breathing, which is called the bumblebee breathing. Because when we make the sound, it has been shown that the nitric oxide in our system improves. And this actually, bumblebee breathing is very good, especially for post-COVID recovered people, people who have sinusitis, people who have a lot of nasal allergies, etc. Because what it does is it improves the nitric oxide inside here, and so it actually cleanses out the nasal and the oral cavities. So for this, you just have to shut off all external noise. Don't do it, just listen to me. Shut off all external noise and make a buzzing sound like a bee. Some of you may feel more comfortable making a sound or but ideal is to make the sound like a bee. Do you want to try it? You can unmute yourself if you want. Little child is doing. That's it. It's easy. Even a child can do it. Do it, baby, whoever you are.
Do it, yeah.
Now, the reason why I'm teaching you these very simple breathing exercises is you can do these in the office. You can just, while you're simply relaxing for that 5 minutes, you can do, you can trace this picture, or you can just imaginarily trace on the paper. You can do these, they are all de-stressing. So if you just do this for 5 minutes, 3 minutes, 2 minutes, 10 times, you'll find that you become much calmer. And they're easy to do and simple to do. This is not, let me assure you, this is not standard traditional pranayama, which requires a lot more discipline. This is just deep breathing. And we are meant to breathe deeply, because what happens is, yeah. So if we don't breathe deeply, this what happens? See, now it has become very fashionable for people to have what are known as adaptable tables at work. Now you can sit and work on this table. You can elevate the height and put a chair like this, which gives you a forward tilt and which helps you to straighten your spine. You can elevate the table further. You can stand and work like this. This is not a good posture because again the eye is going at an angle. Or you can work like this where you're fast and fully standing erect and working. Now I've got a whole set of exercises which you can all try. Now what you can do is just simple neck bends. So before we do the neck bends, what we want you to do is just, let me, okay. What I want you to do is, this is not yet a neck bend. What you have to do is simply hunch your shoulders, relax. Hunch your shoulders, relax. Hunch your shoulders, relax. That is one of the exercises. The other exercises, just turn your head. When you're sitting at a computer for a long time, all of these will actually help relieve you. Then so this will stretch the neck muscles for you. So that is a very useful thing to do in the office. Then you can just stand up, hold your at the waist and just rotate your hips. This will ease the lower back muscles and make you feel comfortable, especially when your back is very stiff. The other thing is, you don't have to rotate your hip, you just move it from side to side. You can just move it side to side. Can you see that? Yeah. Then rotate your knees, bend down, hold your knees, and just straighten up, release. Straighten up, release. And then go round and round with your knees if you can do the round and round. Then you stretch the side of your body. To stretch the side of your body, you hold your hands up like that and then stretch from side to side. Can you please mute yourselves? Yeah. Can you please mute yourselves? Hello? Yeah. Anyway, so the side stretch, this works on the muscles here and it will give you a good stretch, which will make you feel very comfortable, especially when you've been sitting for a long time. Then just the forward bend. You don't have to go all the way down. You can just stop at this level itself. You can just bend up to here and then straighten up again. See, what happens is during the lunch break when we are working in an office, we spend our time chit chatting here and there and all that. I always tell people just go for a walk and chit chat. If you want to do your chit chatting, keep walking. Most IT companies have got beautiful gardens. So walk around the garden, you're be in touch with nature, you're walking, and so you're getting some exercise, you're breathing fresh air. So these are all things that you can do if you have enough privacy in the office. But some of these exercises, you may not have the enough privacy to be able to do it. So you have to choose what works for you. So now, for instance, this may or may not work for you depending on whether you have a separate office or you have a combined office space with other people. So you can twist your body using the same leg stretch. All of these improve this part of the body very much. They give you tremendous relaxation and uh, strengthening of the entire paraspinal muscles. Then you can do this for your feet. You don't have to bend, but you can just, if you want, just lift your foot on your heel, then on your toe, on your heel, on your toe. You can do that also. That will help relax the foot. Arm swing. Just have to go round and round. You have to just do this kind of movement in the arm swing. You can do a upper back twist where you take the arm and go backward like that. You take the arm backward. You can do just a waist twist. You can keep the hands down and go as much as you can. You can turn. And the kidney twist we'll leave off for now. That's a little more difficult. And last but not least, you can open out your chest completely like that. Stretch your back completely. Give the spine a full extension. And you can also just do this. This is actually supposed to balance your aura. So when you do this, you're gathering the aura and balancing it. So you'll find that many of these things can be done sitting in a chair. You can just, this is called the tricep stretch when you do this. So you can do this sitting in your chair. You can just lift it up and down like that. But ideally what you can do at your desk or office are very simple. Just sit in a chair and raise your hand, sit for a while. Sit down and do a twist, a seated twist. Sit down and do a side stretch. Lean from side to side. Sit down in the chair, put your knee like this, put your foot on top of the other knee, and then stretch this knee. Press it down and stretch the muscles there. The other is get up as if you're sitting, half sit, hold that pose for a little while. You can sit down and just keep your hands in front of you for a while. And I told you, you can do the tricep stretch. These itself will work on your upper body. What we showed earlier will all work on your spine and your lower body as well. So you can even do things like this sitting, but be careful because the chair can go off under you and you can fall. So you need to be careful when you do things with your chair like this. So this one is okay, it's fairly safe, but that can be dangerous if you don't do it correctly. Then of course, this is you can do exercises for your hand to prevent the carpal tunnel syndrome. Just put your hands against the wall and then give it a good stretch here. Same thing with just with one palm you can do, and you can give this part of the hand a good stretch. These also will help. When you do this and you do this and you do this, that also gives a good stretch. So there are various exercises that you can do. Very simple hand exercises, just closing and opening your fingers, moving your wrist up and down, rotating your wrist, then pressing your hand against the table. All of these will relax your fingers and your hand and your wrist. Finger exercises you can do with one finger like this. You can do it on your hand. Each finger you can stretch out like this, and you can do exercises like this for your fingers. So that's for pain. Don't worry about that. You can do exercises for your feet also, where you curl your toes, you raise your heels, raise your toes like that. You go rotate those two movements. and that can also relax you. And last but not least, when we join the two hands together like this, we are actually balancing the right and the left brain. So our namaskaram or namaste posture is very good for this. So there is a modification of this where you can do to one side like the dancers do. You can take it like this. It gives a good stretch for this part of the body. So now I'm open for a little while for interaction. So can all of you please unmute yourselves, and up to now, any doubts, questions?
Doctor, very good evening. Your presentation was really very interactive. I just have one small query. I think you have covered mostly on IT professionals.
Yeah.
Myself being a teacher, we always have this problem of standing for long hours, and later on we have this problem of varicose vein coming into picture. I'm not a medical practitioner, but I just heard bits and pieces that we get this problem. Will all these stretches help out for even for teachers, or should we practice something different?
Okay.
Thank
now,
you.
in case some people are planning to leave the session, I recommend you stay because I've got something very special for you in the end. So this is just to give me a little bit of rest and also to address any important questions, because the session is not fully over. There's a little bit more, and that's a really special element. Okay. To answer your question, sir, prolonged standing, whether you're a nurse, whether you're a policeman, whether you're a teacher, can predispose to varicose veins. And this is the reason why you will notice that nurses wear stockings. Doctors don't wear stockings. The reason is that that stocking is supposed to give support for the veins which drain the blood from above downwards. Now we have veins in our legs which have got little valves. The valves will catch the draining blood and make sure that a whole lot doesn't go and collect there. So you need to support your thigh, your calf muscle. Now, if you look at the policemen, in those days, policemen used to wear shorts and wear one patti around their calf muscle. Now, that was meant to protect against the varicose veins. So, if you want to protect against varicose veins, it is good for you to either wear a patti around your calf muscle when you're going to work, or wearing a stocking which supports you right up to the knee. It should be a firm stocking. But in hot weather, both of these can be a little uncomfortable. So you can take just a elastogrip bandage, which actually absorbs sweat, and you can put that around your, the other thing is to periodically, when you sit down, to elevate your legs so that drainage happens. So that also will help. Pregnant women, because of the load of the uterus, which is full, which is heavy, they very often, for the first time in their lives, will get, after a pregnancy, they will get varicose veins. So that is why even pregnant women, we teach them to, when they are sitting, to periodically have their legs in an elevated position. So these are all small precautions that you can take, but in some people, in spite of precautions, it can occur. So the whole thing is about avoiding prolonged standing. So maybe you can write on the board for a while, sit down in the chair and explain something, again get up and write on the board. That's the kind of thing that I can suggest to you. Have I answered your question to satisfaction, sir?
Yes, doctor. Yes, doctor. Thank you so much. Thank you.
Okay. Any other questions?
Hello, ma'am. I am architect Gauri. I'm working on a project where we design furniture for handicraftsmen who are sitting on the floor. So they sit for a very prolonged time in the cross leg position and sit in a very and do very concentrated work, which is very detailed sort of work. But they don't have any choice of a very special furniture or anything. So we are trying to design a furniture for that. So naturally, when we sit on the floor in the cross leg position, we actually have that the lumbar is kind of straightened out. So how do we address this? Like I was
So
actually
you-
thinking.
The usual thing which most of the yoga people recommend is to have a 3 to 4 inch cushion just under your buttocks, because when you're sitting
Okay.
on the floor, that gives you just the right amount of support for the spine to stay straight. The second thing is, when they are sitting, give them something. Haven't you seen in some places for meditation, they have a kind of meditation chair which is foldable, which you can open
Yes.
out, and then it'll be like this, and the person will be sitting here with their legs in front. You
Okay.
understand what
Yes,
I'm trying
I've
to
seen.
say? So you can give that kind of a folding thing which you can open out, and with a little bottom cushion here on which they sit, and they're likely to see periodically they can do that, no?
They can lean back.
Just lean back a little, and because it's foldable and portable, you can position it anywhere. And if you're designing, I'm sure you will come up with a, I'm just giving you the principle. I'm sure you will come up with a great design for that. Because
the
that will be
cushion
very
we make-
useful for anybody who's sitting on the floor. Not just the workmen, particularly, yes, you've got a clear target in mind. But it's useful for anybody who, see, I can't sit on the floor for long.
Yes, sir.
You see, so I've got one of those things, that kind of sitting thing. So all of us can make some adaptations to our body types.
Okay. I understand. Thank you, ma'am.
Right. Anybody else? Otherwise, I can proceed. Okay. I will. When they introduced me, they said I've started an initiative called Be Your Best with Dr. Pritika Chari. In this initiative, we rewire brains, we improve mindsets, we give you better health outcomes, we help you to lead a balanced, happy life, and we give you enhanced stress hardiness or stress fitness. Now, what's that? So if any of you want more information about us, our website is drpritikachari.com. You can call this number between 10 a.m. and 5 p.m. Monday to Saturday. And this is the email with which you can communicate with me if you want. We also have a course, which is a video course, Change Your Health, Brain, Change Your Health. We have another course on the child's brain, conception to 5 years, which is the first growth spurt of the brain. We have another video course, 12 to 21 years, when is the second growth spurt. You can go to my website, you can download 2 free ebooks, one on 10 things to do to improve outcome after illness, another one on how to tap into the healing of your own body. So you can book a trial 1 hour coaching with me. All these are available on the website. Don't worry about it. And you can do a one-to-one coaching session, which is 2,500 rupees for 1 hour. Or you can sign up for a package of 5 hours over 2 weeks, which will cost you 10,000. So these are payment links. They are available. For medical consultations, the number that you have to contact is different. And this is the number 98409-92310. This is just for information, because many people have, 2 people have asked medical questions in the questions. And in such a platform, we do not give medical advice. I'm doing a live webinar on the 30th of June at 6:30 p.m. The investment is $499, and that also is available on the website. You can go and check it out. We started a club called the Creative Karma Virtual Club, and for those members of the club, they get a discounted price. We have 18 dedicated members. We have closed the membership, and we will be reopening the membership in the beginning of next year. So now we will go to the mudras. Now, mudras are actually very powerful things that we can use. And I'm going to give you 5 mudras which are useful to de-stress you. So, the usual posture to adopt to do a mudra is to sit in Padmasana, which is very difficult for majority of us, or you can sit in Vajrasana, or Sukhasana is simple Chaplangol, or you can sit in a chair with your spine straight and your thigh this thing and your feet touching the ground. Mudras can be done whether you're sitting, standing, walking, lying down even, and it should always be done on an empty stomach. Your body should be relaxed, and your mudras can balance an element in your body very quickly, or as quickly as even in 45 minutes. Some have an immediate effect itself, and they are very, very good for de-stressing, because I use it very often. When the pressure is building up too much and I don't have time to really go and relax, I just sit in a mudra for 10 minutes and then I'm fine again. So they are hand gestures. They are very often used in conjunction with pranayama, which I'm not going to specifically teach you. I'm only going to teach you the mudra part of it. So we have to start each mudra by doing what is called as washing your hands. What you have to do is you rub your hands like this. All of you can do this. Hold your hands in front of your navel and rub it like this. So this energizes your hand and makes it ready for doing the mudra. Ideally, for a mudra to be effective, you should hold it for at least 15 minutes. But it is like anything, you should not overuse or abuse anything. So in 24 hours, if you do 2-3 types of mudras or 10 types of mudras, it doesn't matter. More than 48 minutes in 24 hours is not recommended. So you can spread out that 48 minutes throughout the day. So you can do 15 minutes, and another 18 minutes. So you can do it thrice a day in 15-minute modules. That will be ideal. So the first mudra is called the Gyan Mudra. All of you can try it. Try to keep your other 3 fingers straight. You can do this with both hands or with one hand. It helps to increase your concentration, your knowledge, your memory, and you can do this sitting, standing, lying down, but your back has to be straight. The next one is the Prana Mudra. Prana means life energy. So if you want to boost your energy, the Prana Mudra is very good.
Boost your energy.
It will boost your immunity.
Immunity booster. Dita anguti dita sida.
It improves the health of the eyes and improves the health, your fatigue. When you're very tired, the Prana Mudra will give you energy.
Energy.
Prana mudra.
Then take your ring finger and your thumb together. This is called the Prithvi Mudra. This helps you to get grounded. It balances and strengthens your body and also reduces fatigue. So when you want to feel grounded, keep your feet flat on the ground, keep your hands on your thighs and hold it in Prithvi Mudra. The ring finger approximates with the thumb.
Immunity.
Then you've got the Vayu Mudra, which is, it is to balance all the air in the body. Vayu is air. So you take your index finger, make it touch the cushion of the thumb here, and then press it with the thumb like this and keep the other 3 fingers straight. It will regulate breathing and gas in your tummy and also relieves pain.
Angutita.
Bisyangu.
Bisyanguttaku inti chapinta.
Then we come to the fifth mudra, which is the Surya Mudra.
Bhai
The Surya Mudra is your ring finger again, but you press it with the thumb. This
Surya.
regulates the heat in your body.
Garmi eta
So it's called the Agni Mudra.
Agni mudra.
So somebody wanted a solution for a hypothyroid state. Agni Mudra will help a hypothyroid person by boosting the metabolism of the body. It also helps in obesity. It helps to relieve constipation and metabolism related problems. So you can just do the Agni Mudra for 10 minutes in the morning and 10 minutes in the evening. And you will find that your metabolism is maintained very well. The mudra that I use most is the Gyan Mudra, the Prana Mudra, and the Anjali Mudra for inner peace and balance, which is just Namaste. The Chin Mudra is what I use when I meditate. So it enhances concentration. But the last, most important mudra, if you really want to know, which balances all the elements in the body, is this mudra. This improves your brain power. Just take the fingers of all the 5 fingers of the hand and touch with both hands. Hold it in your lap in front of your navel. Just sit with this for 15 to 20 minutes. You will find that your brain energy improves because it balances all the 5 elements in the body. Okay, I told you I had something special for you people. Now all of you can settle down comfortably in your seats. You're going to do a guided visualization. You're going to do a little meditation. So sit down calmly, put your hands on your laps with your palms facing upwards. Keep your feet flat on the ground. If you're sitting on the ground, either sit in Padmasana or Sukhasana or Vajrasana, preferably Padmasana or Sukhasana. Or if you're sitting in the chair, keep your feet flat on the ground and just listen to the voice of this person.
Welcome, and thanks for taking out the time for yourself for what will hopefully be a nice inward journey. So just start off sitting.
Is it clearly heard or do you need more volume?
No, ma'am, we need more volume.
Okay.
Little more volume.
Can that some person who's making a lot of noise mute themselves?
Others, please mute.
I'll have to go and mute, I think. Has it stopped? Yes.
Upright, feet planted on the ground. If you're ideally on some, for taking out the time for yourself for what will hopefully be a nice inward journey. So just start off sitting upright, feet planted on the ground if you're ideally on some type of a firm chair, and start to soften your gaze. If your eyes are still open, gently close them. I like to leave my hands on my lap, palms up to the sky, but whatever feels comfortable for you. And then with your eyes closed, gently become a little bit more aware of your breaths. Make them a little bit deeper and a little bit slower. at your own time. Breathe in, breathe out. Just a little bit deeper and a little bit slower. So the whole idea behind meditation is trying to ease all the chatter that exists in our brains, trying to still our thoughts. And so as we do that, in every meditation, I'm going to try to introduce some frameworks, ways of thinking about your mind. But as you try to quiet the mind, it will inevitably get distracted. It might get distracted by some noise in the room or some noise outside, or more likely, it'll get distracted by thoughts that are just surfacing into your consciousness. And if that happens, don't let it make you anxious. A lot of folks, when they meditate, they worry that they're doing it wrong. And then if they get distracted, it actually makes things worse. They say, I'm never going to be able to do this meditation thing. The important thing is to approach the meditation with a spirit of fun, a spirit of curiosity, have a sense of humor about it. We are all literally human and we do very human things. And so when you find your mind wandering a bit, just laugh it off and say, oh, there you go, mind. Just come back to the stillness. Not a big deal. Don't beat up on yourself over it. And as part of that, as we go through this meditation, as much as possible, try to keep a little bit of a smile on your face. Your eyes are closed, but you can still smile a little bit, or at least smile with your mind. Reminds you that this should be fun. This is relaxing. So with that said, let's keep breathing in, breathing out. A little bit deeper, a little bit slower. And the framework that I'm going to introduce for how you can still your mind is one that I use a lot, which is imagining all the thoughts in your subconscious as the ocean. And the surface of the ocean is the interface between your subconscious and your consciousness. And most of us have a pretty choppy surface. There's a lot of thoughts that are jumping up and down out of our subconscious. And sometimes we're drowning in those thoughts. And one way to think about it is we can elevate ourselves. We can elevate ourselves above the surface of that water. And when you start to elevate yourself, you're not suppressing the thoughts, but you're just looking down on them. You see that they're still there. The surface is still choppy. There's still waves. But as you rise and you look down on it, you realize that you are not those thoughts. You are not the surface of the water. So whether the thing that's bothering you is an assignment you have to do, or some interpersonal relations, or just something in your life not working out the way that you would like it to, remind yourself that that is not you. You are not defined by the outcome of that situation. Those are just waves on that ocean. And the more that you surface above them and you look at them and analyze them, you realize that they have no control over you. And once that happens, things start to slow down. The surface of that water begins to get calmer and calmer and calmer. And there you are, floating above that surface, just pure awareness. And you realize that you're a lot more than you thought you were. You aren't just your physical body. You aren't just those thoughts that you see as waves on the surface of that ocean. You aren't even just that identity that you associate yourself with. Your name, your position in the world, your status, what people think of you, your relations. Those are aspects of you, but they aren't you. You are something much bigger than all of them. You are the space in which they occur, in which they happen, but they aren't you. And now let's just try to sit in that pure awareness for the next minute or so. And once again, if your thoughts wander, not a big deal. That's just the choppiness on the surface of that water. You need to elevate yourself back to that pure awareness. And if the quiet bothers you, don't worry. I will be back in about a minute. Well, welcome, and thanks for taking out the time for yourself.
Sorry that,
Yes. And if the quiet bothers you, don't worry. Don't worry. And over time, you won't need me talking. In fact, that will probably annoy you. You'll just be able to sit down and still your mind and realize that you are not your thoughts. And that these things that are bothering you, they're only going to bother you as much as you let them bother you. And in the whole scheme of things, in all of time and space, none of them are really what should define you or are anywhere near as important as we sometimes make them out to be. I'll see you in the next meditation.
so thank you very much for being so patient with me and giving me this opportunity. I'm available for questions. I'm sorry that the timing got misfired because of my unfamiliarity with the various technical issues. We should have finished by 7 p.m. I never exceed time in any of my sessions. My apologies for that, because many of you may have other programs. So if there are any questions, I will stay back to answer them. And there were two questions in the chat which I shall address. One was, somebody asked, can we keep a stool? If you are talking about sitting on a stool or lifting your feet on a stool, whoever asked that question, you can clarify. And another person asked about, wait, I'll just check that question again. He just said, can we use a stool? I'll see who that was. Sumant asked, can we use a stool to keep our legs? Yes, I suppose you can. I actually have a big cushion kind of thing, like a, what shall I say, like a moda on which there's a cushion. Because I sit in the chair and I fold my legs like a Padmasana and keep it on the chair, on that, instead of sitting with my leg hanging. So you can make some adaptations to whatever suits you. Then somebody wanted to know, why is this called office yoga? See, I am not a yoga therapist. I am not a yoga exponent. These are modified little postures and stretches and flexible things, which I have put together from my gym work, from my yoga work, from so many things. I practice various yogas. So it is just a bunch of things which I put together, which I find useful in when I'm doing my office work. And so I called it office yoga. Somebody had raised that question as to why we called it office yoga. Then there is, many people have asked for the video and the feedback, and what I'd appreciate a little feedback before I close.
Okay, thank you, Dr. Pritikachari, for your wonderful and timely session. Basically, people are staying at home and then doing the office work. So work from home has become a norm today. And this session has been very, very useful for the people, and particularly our society members, who have been working on computers and things like that, particularly the ergonomics. In fact, though we are familiar with the side effects of not having properly seating and then sitting and working, but still we end up practicing whatever we feel convenient. But the side effects are known only at the end. I mean, after few years, particularly, it's a question of that we take certain things granted, and then we continue to do whatever we feel like doing it. So there is no perseverance in terms of practicing certain things. So anyhow, it is a timely warning for most of us that we need to practice certain things in a particular way and so on. Thanks a lot. And just before we wind up our session, one or two questions I would like to pick it up and answer. Are there any side effects if it is not done properly, the yoga and other practices, if they are not done under proper supervision or not done properly? What are the side effects, we may?
See, watching television and doing yoga is not something that I advocate. See, yoga is also a science. It has to be taught properly by a person who's capable of teaching you, and you have to do it. Now, that is why I gave this disclaimer that I am not a yoga teacher, I'm not a yoga therapist, but these are simple stretches which I advise my patients also. You see, so for the neck stretches for cervical spondylosis, lumbar spondylosis, we advise them many of these spinal exercises. And they are just simple stretches that which we do before we start a serious gym workout and things like that. So I have just adapted and I practice mudras. I practice meditation. And these are de-stressing mudras which I use, which were taught to me by a yoga teacher.
Okay.
So that is why I did not get into serious pranayama with you. Though I do practice pranayama, which has been taught to me, I am not competent to teach you. So I just taught you the breathing exercises which we make children do. Tracing shapes and this thing, and just question of deep breathing, because deep breathing versus shallow breathing has advantages. And now there is so much focus on breath. So if we keep doing these little breathing exercises ourselves, just taking a few deep breaths periodically, we have to remind ourselves, that's all. That itself will keep our lung, functioning well. But if you can learn serious pranayama, there are ways, there's a methodology for everything. See, even for the mudras, I gave you the methodology, basic methodology.
Okay. Are these yoga practices vary with respect to age? Like, for example, children, middle-aged person, and senior people?
Most certainly, see, yoga is not just the exercise. It's the physical aspect of yoga is what is always focused. Yoga is more than that. Yoga is a way of thinking.
Which means that...
So a little maturity is needed, but children can be taught the postures, the asanas. It can be made fun for them. But there should be a little bit of mental involvement in the whole process. So it is a way of life. So there's a way of thinking, some breathing in it, the mudras, all of this put together is what will be a yogic practice. Diet.
So which means that the senior people will have some restriction in terms of doing various yoga.
Actually, yoga is a very good yoga, Tai Chi, Qigong. These are all flexibility enhancing, balance enhancing exercises which are perfect for senior citizens. But when it comes to flexibility, seniors may have some limitation.
Yes.
But that is why you should not do it from the television. You have to be taught. So the yoga teacher will take you, like before my surgery for my cancer, which was an 8.5-hour surgery, I had 3 months time after my radiation and chemotherapy to get ready for the surgery. So I strengthened my abdomen. I did a lot of exercises to strengthen my abdomen. Also, they told me that my legs would be in this position for 8 hours because the surgery was in the rectum. And that can cause nerve paralysis. So I know that if it is stretched for so long, they put gel pads and things to prevent nerve paralysis. But I did exercises with my yoga teacher specifically to widen my pelvis. And I withstood that 8.5-hour surgery with my head down and my legs up position without complications. Even then, I lost little sensation on my thigh for a while. There was some nerve compression there. So you have to learn to do it properly. Now, I cannot come and teach you those same exercises and say, yeah, I did it, it benefited me, you do.
Okay.
It
So
was
it requires-
tailored to my requirement. I was 70 years old at the time. So it was tailored to what I'm capable of handling. You have to think of the heart, you have to think of blood pressure, think of diabetes, you have to think of obesity, you have to think of so many things. When it comes to the senior citizen, you have to. So the yoga teachers are wise, they tailor it to us. That is why senior citizens should not go to a yoga class where people of different ages are being challenged and you will not be able to meet the same challenge. A young person may stand on his head, you can't stand on your head. So you better to have individualized teaching. That is why the Krishnamacharya Yoga Mandram model is very good. They do one-on-one teaching once a week, and then you practice those exercises and come back.
It's in Potturpuram, right?
Yes, that model is a very good model for senior citizens because they spend 1 hour with you and teach you. They draw diagrams, everything, and give it to you. I send a lot of my patients there.
Okay.
So even patients, they can adapt to the yoga pose to the patient and what the patient is able to handle.
What is the difference between meditation and mindfulness, Doctor?
Mindfulness is something you can practice all the time. Like we are doing this session. Mindfulness is for me to be 150% focused on the session. No distraction. I'm totally focused on the session. I don't even notice what is happening around me. That is mindfulness. You can be mindful when you eat, where you're not eating automatically, watching television, or eating automatically, not even thinking about the food that you're eating. Instead, mindful eating means taking the food to your knowing, experiencing the fact that your hand is moving up to your mouth, appreciating that gesture, putting the food in the mouth, tasting the food. One of the mindfulness exercises many Zen teachers teach is they'll give you just a little bit of an orange with just few of those little things. And they'll ask you to keep it in your mouth and feel each one, break each one, feel the juice come out, appreciate it. See, that is mindfulness. So you are totally in the present moment. That is mindfulness. Meditation helps you to be mindful and brings you into the present moment. But if you're able to be in the present moment in everything you do, then you are mindfully living a mindful life.
During this working from home time, now we are highly indisciplined in terms of eating habits. Ultimately, we are inviting ourselves to eating disorders. Is there anything we can do to avoid that?
I have a very, very simple formula. I tell people, do not work from home differently from working in the office. See, I learned this lesson 10, 12 years ago. I spent some time with a couple of my friends who are in London. They were working from home 12 years ago. Husband and wife were in different jobs. So what we used to do was, there are 2 children. So we all get up at the usual time in the morning. The children will be attended to. The lunch will be packed. They'll be put in the school bus. All that, all by 8:30. Then 8:30, we will sit for breakfast. By 9:30, all that work is over. Then the wife will go to her office space in the living room. The husband will go to his room, one room upstairs, which is set up as his office room. And they'll tell me, you do what you want with yourself. They won't even look at me. They won't even talk to me. They are totally focused on their work. When they go to their office space, they take a bottle of water. They take some juice if they feel like it, and maybe some biscuits. So they don't even get up from the office space for that. But there was a garden. So at about 11 o'clock, she'll get up, take a glass of water, As she's drinking it, she'll go and walk in that garden and come back and do her work. But she won't talk to me. I don't exist. 12:30 sharp, lunch break. In England, it's always 12:30, not 1:30. So 12:30 to 1:30, we'll all get up, have lunch, whatever, organize the lunch, eat, clean up, whatever. Again, 1:30, they'll go. 5 o'clock sharp, she'll get up from her seat. So just like going to office. And that 5-minute break that she takes, 5 or 10-minute break she takes for coffee, will be about 3:30. Even then, she won't talk to me. The coffee is made in lunchtime and kept in a flask. So if we do that, where are we going to eat erratically?
Yeah, but unfortunately, it is.
No, so routine, having the same routine. What we are doing is, if we are used to getting up at 6:30, 7 in the morning, we are getting up now at 9:30 because we don't have to commute. We're not having a bath. We're not getting ready. We can sit in our t-shirt and shorts in which we went to bed. So that is what is causing the problem.
Yes, that's why we have become
We need to maintain the routine. One of the ways to keep your mental sanity also is that, because if you keep spending time in your home clothes all the time, you get a little disoriented. So if you want to conserve your mental health and your physical health, follow the Pomodoro technique, which I told you, 25 minutes on, 5 minutes off, 20-20-20 rule. Maintain your daily routine. The commute time can be used for getting some other work done in the house. Even in the evening, I tell especially women, 5 o'clock sharp, you get up from the thing, don't plunge into your housework. Think, if I had to come back from office, I'll come back only by 6:30. So 5 to 6:30, do your own thing. Catch up on something else. Go and wash your hair. Or do something you want to do for the children. Or go spend time with the elders in the family who want your company. Start your housework at 6:30 when you're normally used to starting. What does it matter? Nothing is going to happen. So we have to bring in that self-discipline. I don't know how many of you agree with me, but I think that keeps you sane.
Yeah. Okay. Thank you very much, Doctor, for your wonderful advice. And now I request Dr. Saktivel to formally propose our doctor. Dr. Saktivel?
Yes, sir.
Wait, there's a question. Ananta Padmanabhan wants to know the phrase I used after Tai Chi. It's called Qigong. Qigong. It's a Chinese, very smooth kind of exercise. You'll find people doing it in the parks. So Tai Chi, Qigong, and yoga. I'm sorry I interrupted you. Right?
Okay, madam. Good evening to all of you. Today is the International Day of Yoga, and we have got a suitable title for our program also today. It is Ergonomics and Office Yoga. So on behalf of the Computer Society of India Chennai chapter, IEEE Computer Society Madras chapter, and ACM Chennai Professional chapter, we would like to thank today's resource person, Dr. Prithia Chari. She has explained how we should behave in office and some simple techniques to relax us, some simple techniques to avoid back pain and other complications when we are sitting in the office. So this lecture is really very useful to the people who are all sitting and working in the office, as well as IT and software professionals. And moreover, finally, she has given very good advice for all the people who are all working from home. So it is very, very useful advice to all of us. So on behalf of all the societies, we would like to thank Dr. Prithia Chari for your excellent session on ergonomics and office yoga. Thank you, madam. And I would like to thank Mr. H.R. Mohan, who is backbone for all our activities. He has organized this program. Thank you very much, sir. I would like to thank Dr. Priya Vijay Chairman, Computer Society of India, and Mr. P.V. Subramanian, past Chairman of Computer Society of India, and Dr. Ahila for their excellent support in organizing this program. And finally, I would like to thank all the participants who have actively participated throughout the entire session. Thank you, and all. Thank you very much, madam. Thank you.
What is ACM?
Association for Computing Machinery, madam.
Okay.
It is the largest professional society of computer science and IT professionals.
Okay, because I was wondering today
Yes,
what
ma'am.
ACM stands for.
Association for Computing Machinery.
Okay, thank you all very much.
Thank you,
And
madam.
really,
Thank
I
you.
apologize one more time for all the technical delays that I.
Definitely, I will
but
follow your
Don't
advice.
worry, I'm getting there. Every successive thing, I learn something new,
Yes,
and
ma'am.
I'm continuously learning, and so I think I'll get over it.
Now over to Mr. H.R. Mohan for final remarks. Sir, please unmute, sir. Mohan, sir, please unmute, sir.
Thanks, Doctor, for accepting our invitation in a short notice. Basically, we hardly gave about less than 2 weeks time. And, it was very nice. In fact, I had the opportunity of attending one of your session. Then only I got prompted, that International Yoga Day, we used to organize some program and I totally forgot about it. And immediately I contacted and you were also very nice that you could accept our invitation. Thanks. Thanks a lot, Doctor.
You have to tell me when I can end the meeting.
Huh? Yeah, I think
Because
now,
I'm the host, no, so I need to know.
yeah, if there are no questions from any audience, we can possibly we can wind up.
Okay. Fine. I'll end the meeting. And
Okay.
thank you all once again, and have a great week ahead.
Thank you, doctor.
Thank you, madam. Thank you, doctor.
Thank you. Bye.